Hi, I'm Dr. Greg Reiser. I am a board certified cardiologist. It's a comprehensive program that looks at carotid arteries for carotid artery narrowing, checks for atrial fibrillation, which is one of the leading causes of stroke in this country. We screen and look at your abdominal aorta, looking for an aneurysm. And we also look at pressures in your upper extremities versus lower extremities, which is an indication of narrowing in your leg arteries if it is indeed present. We also will be measuring your hemoglobin A1C, which is an important indicator of presence of prediabetes and diabetes mellitus, which is exploding in this country. It's a fast, easy series of screens for really a minimal amount of out-of-pocket expenses. Everybody over the age of 50 clearly is a candidate for this, especially men who've ever smoked as little as a pack of cigarettes in their entire life are at high risk. Anyone with a family history of stroke, atrial fibrillation, abdominal aortic aneurysm, or peripheral vascular disease over the age of 50 clearly should be screened. Unfortunately, only 1 in 5 people have any symptoms of carotid artery disease before they have a stroke. A lot of carotid artery disease is diagnosed after the fact, after you've already had an event. And the strokes that occur as a result of having carotid artery disease are large strokes. Typically, you get flaccidity or loss of function in an arm and a leg on one side, a facial droop on the other, and the intellectual embarrassment that you get as a result of having a stroke of that magnitude is really debilitating. It's a very silent, insidious process, and there aren't a lot of symptoms, unfortunately, before it happens. With respect to abdominal aortic aneurysms, they too are incredibly silent. People have nondescript abdominal pain until they present with a catastrophe that might not be survivable. Peripheral vascular disease involving the lower extremities is more insidious. People tend to slowly lose function of their lower extremities, get achy pain in their legs or their thighs or their calves, and their exercise tolerance slowly gets reduced over time, and people kind of poo-poo this to, I'm just getting older, just getting tired more quickly. They also can have a significant event involving their lower extremities. In addition to that, lower extremity circulatory problems are not always confined to people over the age of 50. Young, athletic people can get constriction of their arteries at the level of the groin and the calf, especially those who are super fit. So the screening that we do for lower extremities also has the utility for the athlete who's having calf and thigh pain with especially peak exercise. Atrial fibrillation is notoriously silent. It tends to come and go, and come and stay. But we now know that a family history of atrial fibrillation connotes a tenfold risk in the progeny or the offspring of that person having atrial fibrillation as an adult. Other significant causes of atrial fibrillation include high blood pressure. So people with high blood pressure should periodically have EKGs, not only to detect the presence or absence of atrial fibrillation, but left ventricular hypertrophy, which also can easily be seen on a EKG that we perform as a result of this screen. Screening is completely non-invasive. There's no needles, there's no dye, there's no injection, there's no contrast. we use ultrasound, same technology that is used to look at babies inside their mother's uteruses. It can't cook you, it can't hurt you, it's painless, and we can actually see the interior of the arteries with unbelievable clarity. Hemoglobin A1C does involve a needle stick and lab work sent to a lab, but that's as invasive as it gets.